And to start, we are going to start with some definitions. And when we discuss research in a university setting, probably let me start with something where I say here at the University of Louisville, there are always, whenever you start here, we do patient care, we do teaching, and we do research. And these are the three things that we are supposed to be doing. And probably is a patient care or service, because you teaching and then research. And when we discuss research, we understand in the context of the university, in the context of science, research is the generation of new knowledge. We are going to generate new knowledge. And research can be probably divided in basic research and clinical research. Then basic research, we are working primarily in the laboratory. Clinical research, we are working primarily with humans. And this is what we are discussing today, clinical research. Then we can say that when we are doing clinical research, we are working with primarily with patients, and we are going to generate new knowledge. And this new knowledge has certain characteristics. It's a new knowledge that we're going to generate based using the scientific methodology. And this new knowledge has to be also disseminated. Then it's new knowledge that we're going to disseminate. It's interesting because when people say, what is the most important role of the university? I may say that service of patient care can happen in any institution in the U.S. There are a lot of health settings. Well, we have Norton, or Baptist. Let's make it Baptist. That is, it's a non-academic medical center, and patient care is first class. Let me say teaching. Well, universities were developed for teaching. But still, the idea is that you can have residents and medical students going with a private physician, or you can do teaching also in other settings. There are some areas that are disappearing here from my... All of a sudden, the triangle of the university is no longer there. I don't touch anything, but then to me, this research is what really separates the university from anything else. It's the capability that we have here in a university setting to do research. Because to do research, you need a village. Now, to do research, you need collaboration. You cannot do research just on your own. You need to have teams. You need to have collaboration. And this is what the university gives us, the possibility of these large collaborations and the possibility of doing, having in the same place people with different specialties, this interprofessional. Then this is what we're concentrated today. This is, to me, the difference. If you are in an academic setting, the difference is that you are going to be able to do research. And now, someone may say, well, yes, industry is not university, but they're doing research. Well, yes, there are other areas that you can do research, but this is going to be the big difference. Then, let's go back to clinical research. That this is what we are discussing primarily today. Then with clinical research, we generate new knowledge. Then we are doing everyday patient care. We have patients at the university hospital, and we treat the patients. Why is that we treat the patients today different to what we used to treat the patients 30 years ago? Because there is new knowledge. And this new knowledge is coming from clinical research, and clinical research is going to tell us what is going to be the best practice. Then through clinical research, and for instance, in our area we work in pneumonia, then today is going to be a lot of examples about pneumonia. But why do we treat pneumonia today with different antibiotics compared with or different approaches? Well, through clinical research. Then through clinical research, you have patient care, and you get the best practice. The best practice, we have the national guidelines, and this is where clinical research moves patient care to best practice. And then another thing of the equation, to be able to this best practice to be applied into clinical research and really going to improve outcomes, because this is at the end what we want to have, improve patient outcomes. This is the other section that I want to discuss today, that is quality improvement. Quality improvement is then essentially another way to do research. But quality improvement, we get the best practice and we figure out how to implement best practice into everyday practice. Then we have another way to look at this is that we have patient care, we have best practices, and through clinical research, we get there to best practices. And to quality improvement, we apply this into the patient. And these are the two things that we're discussing today, clinical research and quality improvement research. And there's a lot of people doing in healthcare quality improvement, but only the people that knows clinical research are going to be able to do quality improvement research. Remember that at the end of the day, we mentioned that this is new knowledge that is going to be disseminated. What we're going to be discussing today, then, is the process. In the process, looking at definition, sometimes we mention that, let's say that you are interested in a particular disease, in diabetes, in hypertension, in asthma, you are interested in pneumonia, and these populations. For us, in clinical research, is usually patients. You go to the School of Public Health, they discuss populations. But the populations, we say this is the population, in this case, pneumonia, let's say community-acquired pneumonia, this is the population of patients in the universe. So remember, you're doing clinical research to improve the clinical outcome, not of the patients that you're doing research. You are doing sleep medicine, and you are trying to improve all these patients with sleep apnea. You're doing research in your 30 patients with sleep apnea at the University of Louisville. But you don't plan to improve the outcome of these 30 patients. You're doing research for the 2 million patients with sleep apnea in the universe. You're doing research for the person with sleep apnea in China, in Chile, in Uganda. This is your research. This is the goal. We want to improve outcome of the patients in the universe. Now, what we're discussing today is that here we are at the University of Louisville dealing with my 100 cases of community-acquired pneumonia, and I want to come up with something that's going to improve every patient with pneumonia in the universe. Then what we're doing here is we're going to start with an idea. Oh, yes, I have the idea to figure out, if the patient get admitted to the hospital, when to use this or that antibiotics. This idea is going to move into what is going to be the research question or the study question. We are going to move to, we are going to have the research question. We are going to have, looking at different study design, we develop the study protocol. And then in the study protocol, I say I'm going to enroll 100 patients with pneumonia. Then from the patients in the universe, I'm going to get a sample that are going to be, from the patients in the universe, I'm going to get a sample that are going to be the patients in the protocol. And then I'm going to put my protocol to the RB. I'm going to do the study. I'm going to finish with the patients in my study. And this is, again, let's say 100 patients. From these patients, I'm going to analyze the data that I have, and I'm going to get conclusions, and then I'm going to publish, and then I go from idea all the way to publication. But this publication, what I publish, is the idea is to implement something in the universe. And all these things are important because when you are published, whatever you are publishing, the idea is that are you going to be able to generalize this to the universe? When you submit something for publication, nobody cares what happened with your 100 patients at the University of Louisville. You're not trying to improve these patients. You're trying to use this as a sample to be able to improve what happened in the universe. Then this is the concept. Then, when we do clinical research definition, we generate new knowledge that we are going to disseminate through publication, and it's going to improve the outcomes of all the patients in the universe. And to do this, we're going to apply the scientific methodology. Then, in medicine, I always mention that when you are seeing one patient in the clinic or in the hospital, you're improving the outcome of this patient. When you are teaching 3 medical students or 2 residents, these residents are going to go and improve the outcome of another. Then you multiply your capability of healing, your capability of making an impact. When you're doing clinical research, you plan to improve the outcome of everybody in the universe. Then looking at improving outcomes, essentially, and you're going to advance medicine. If the medical students today get teach something that is different from what you were taught 5-10 years ago, is because clinical research moved with new knowledge, and now we have something new to teach. Then this is the advancement of medicine. This is what we're going to be discussing today. Then every time that we're going to discuss this in the protocol, in the study, whenever you start something, the first thing is the importance of the topic. Okay? You're going to write your protocol. You're going to write your manuscript. If you are discussing the topic of pneumonia is the most important thing that happened to humankind. Okay, well, today we are discussing clinical research, and I bring you the importance of clinical research. Okay, we are advancing medicine. This is what new medical students are going to be taught, but more importantly, we are improving the outcome of the patients in the universe. Okay? Then essentially, we are going to, during the day, just to make a summary, before we go to the first presentation, we mentioned that we have an idea. From this idea, I'm going to move into the study question. From this, from the study question, I'm going to figure out study designs, how I'm going to perform my study. I'm going to end it with a protocol, and we discussed several times the protocol. The protocol is one of the is at the heart of what we are going to be doing. Besides the protocol, there are other study documents that are important in the planning of the study, because sometimes we say that with this planning of the study, there is performing of the study, there is analysis of the data, and then there's going to be your publication. And from the planning of the study, it's going to be a presentation on study design for clinical research. It's going to be a presentation on a study design for quality improvement. In the planning, you need to be looking at the possibility of, whenever you are going to do research today, you always have to ask for permission. This is a rule. Now, I say, well, I'm going to do a case report. Well, there's always the question, am I allowed to do it? And meaning that you are going to need to get permission, and this is going to be the IRB, and this is going to be all the regulatory documents, and we're going to be discussing this. Performing the study, we're going to do data analysis, data quality. We're going to discuss this during the day. After you finish the study, performing the study, you're going to end it with your study database. And the study database, we are going to be discussing a little bit about study databases. Then, during the planning of the study, you end it with the study protocol. And you have the patients in the protocol. I have to tell you, the study protocol is usually the easy part. Because until you finish the study protocol, we can get together today, have coffee, sit around the table, and we can come out in 8 hours with a very good protocol. And you can move it around. Then it's difficult, but at the same time it's simple compared with doing the study. Now you have to go and do the study. Look at the patient, they get the consent, do the screening, follow up, do the intervention. You may say, well, but I want to do a retrospective chart review. Still, you have to go to the medical records. Then you're going to do data quality, data collection, and you want to end it with what? The patients in the database. In your Excel, in your whatever it is, you have your patients in the database. Then you see patients in the universe, patients in the protocol, patients in the database. In the protocol, we would say we're going to enroll 300 patients with asthma in Louisville, because again, what is the difference between 300 and 350 or 400? So just right, 400. Looks better. But then you have to collect the patients. And this is the difficult part. Then you end up with a patient study database. After you have the study database, you're going to do the statistical analysis and clinical analysis. And we're going to have a presentation on this. And after you do the analysis, you get these patients and you're going to publish. Then during the day, we are going to, several times we are going to mention that there is the universe. Wow. The patients in the universe. Then you get a sample. You have the patients in the protocol. Then in the universe, there are 2 million people with pneumonia. In the protocol, you plan to enroll 300. And then you have your patients in the database. You end up with 57. And from these 57, you need to go back and figure out, okay, this is my idea what happened in the universe. This is the concept that I want to be discussing today. And in the afternoon, when we discuss statistical analysis, the only thing that you're going to be able to analyze are the patients here, whatever 100 patients you have here. You decided to enroll 150, but then there's a holiday and the study coordinator was sick and the resident, then you end up with 100. And from these 100, you're going to infer what happened here. Then, the last thing that I'm going to discuss, and everybody has and I'm going to finish with this. Let me see if I can move to the next page. Here, probably. How do I move to the next page? You give me a different program. Please note. It's okay. Then, to finish this introduction, that's going to be 25 minutes, I'm going to mention that from the patients in the universe, we get the patients in the protocol, and from the patients in the protocol, I get a result that I have in my database. In the database. We are going to be discussing during the day that your question usually have what is called, a predictor variable, outcome variable. Then I have this question in the patient with pneumonia, if 2 antibiotics for the patient with ventilator-associated pneumonia is better than 1 antibiotic. Then I look at, and the beauty of clinical research is that you review your patients, and at the end, you always, from your question, you always get a result. But in the laboratory research, sometimes the experiment doesn't work, you don't get a result. In patients, you get 100 patients, you always get a result. Then I have my question, my research question, and then I have the result of my research question. That this is associated with that. 2 antibiotics is better than 1 for ventilator-associated pneumonia. Because with 2 antibiotics, I decrease 10% the mortality. Fine, I got a result. Now, during the day, we are going to discuss multiple times that whenever you have a result, this result, that 2 antibiotics decrease mortality, in the universe, this is the results in your patient in the database. In the database, 2 antibiotics decrease mortality. But again, I'm not interested in the 100 patients at the university hospital. I'm interested here, in the 2 million patients with pneumonia in the universe. Then, if 2 antibiotics decrease mortality, is this the case here? This is the question. And if this is my result, I have always in clinical research or in life 4 possible explanations for my result. Okay, 2 antibiotics decrease mortality. Then one possibility is that this is the truth in the universe. My results are truth. What are the other 3 possibilities? One possibility is my results are not the truth because this just happened by chance. Another possibility is my results are false. This will be the truth. Then this will be false. False due to chance, false because of bias, or false because of confounding. Then, every time that I get a result, and we are going to discuss this in the afternoon, and I'm going to do the analysis, in my analysis, it's always what happened in these 100 patients is what happened in the universe. Am I going to publish and be sure that everybody in every intensive care unit all over the universe is going to use 2 antibiotics instead of 1 for this patient with MRSA, whatever? Because this is the goal. The goal is to improve the outcomes of everybody with MRSA. And this is always the analysis. Now, is this truth? Is this chance? Is this bias? Or is this confounded? And in the analysis that we're going to discuss in the afternoon, we are going to emphasize, again, the analysis from the database is statistical analysis. You look at statistical significance and clinical significance. Once you analyze all this, you figure out what happened here, and this, you're going to get the publication to disseminate your data.